More than 4,000 Gary school students could be left without transportation to and from school if the school district doesn't come up with almost $3 million. Illinois Central School Bus Company, or ICSB, notified Gary School Corporation Superintendent Dr. Cheryl Pruitt that unless a payment plan could be worked out, the company would stop providing bus service on November 10th. Steve Hemmerlein, CEO of ICSB, says the company met with Dr. Pruitt and learned that Gary schools are facing a $23 million budget deficit with no coherent plan for paying ICSB and other vendors. Gary Community School Corporation spokesperson Sharmella Greer says the school system is paying its bills.
There is no plan to actually cut buses. I think what is of more importance is to let the community know that we have not neglected our responsibility. Between August and September, we paid them another $316,000. It shows that the district is working to make sure that the corporation receives money that they determine is owed.
ICSB says it cannot continue to pay its salaries, fuel, and bus maintenance costs if a procedure for payment can't be established with Gary schools. Enhanced screening procedures are now in place at Chicago's O'Hare Airport to help stem the spread of the Ebola virus. And at least one airline is contacting passengers about possible Ebola exposure. Frontier Airlines is reaching out to passengers on its flight 1143 on October 13th from Cleveland to Dallas-Fort Worth. A passenger on that plane, a nurse at Texas Health Presbyterian Hospital, has since been diagnosed with the Ebola virus. The nurse is the second healthcare worker to contract the virus after coming into contact with the first U.S. Ebola victim, Liberian Thomas Duncan. The Obama administration is instituting additional measures to stem the spread of the virus, including sending a CDC rapid response team to any hospital where Ebola has been diagnosed and redoubling efforts to identify all those who may have come in contact with anyone infected with Ebola. We'll have more on the local response to Ebola later in our broadcast. The Indiana State Board of Education announced this week that it is holding off releasing A through F accountability grades for Indiana schools, at least until its next meeting. The decision to hold back the 2013-2014 school year grades was made after the state board heard appeals from multiple schools citing potential errors in the data used to evaluate them. Beginning in 2010, the Indiana Department of Education began rating schools on the A through F scale in order to promote transparency and allow parents and the community to better understand how Indiana schools are performing. The State Board of Education will meet again on November 5th. Ivy Tech University is getting a handout from Uncle Sam to help educate its students to become more cyber savvy. The school is just one of those receiving a grant to help the next generation learn about cybersecurity. Dejanique Garrison has more.
Safeguarding the technology that powers the internet and our mobile devices gets more demanding all the time. That's why the federal government plans to spend $450 million to help community colleges train students in cybersecurity.
Cybersecurity has been about networking for the past 4 years, but now it's morphed to mobile devices. And so we want our students to be learning the very latest that's happening in the real world so that when they graduate, they can get jobs.
Montgomery College in the Maryland suburbs outside Washington, D.C. is one of 270 schools nationwide getting grants. The aim is to put to work a demographic community colleges already embrace.
Any unemployed person, people who are underemployed, who want better jobs, veterans who are leaving the military and coming back to civilian life, women and other underrepresented groups in STEM and cybersecurity fields, and people who have low basic skills who need good skills to get good family supporting jobs.
Now, cybersecurity can range from finding holes in coding to stealing your identity via credit cards. Mahesh Kelva of Lockheed's Washington area office is working on the cybersecurity curriculum for Montgomery College students.
$450 million is a good investment basically to develop the skills that are required to protect our nation from the attacks that have been happening from nation states who are trying to take our IP from our country. And besides that, as you've seen in recently, there have been a lot of attacks where personally identifiable information has been stolen and also credit card information, so which basically impacts the common man. So for us to have a skilled workforce that can protect this data, it's very key.
Schools across the Midwest are also getting a piece of the pie. Ivy Tech in Indianapolis will use $2.5 million to expand the School of Computing and Informatics across 24 sites. The Obama administration says it plans more initiatives to help vocational and technical education in hopes of boosting the economic standing of the middle class. In Washington, Dejanique Garrison, Medill reports.
Highlands Town Theater has just been given an economic boost of sorts. The Town Council voted 3-2 this week to authorize Highlands Redevelopment Commission to restore the historic building. The theater, which opened on Kennedy Avenue in Highland in 1946, closed its doors just a few years ago, ending its run of quirky movies and its long-standing tradition of serving coffee and cake at intermission. The town of Highland purchased the property but had not determined whether to raise the building or renovate it. Theater supporters packed Highlands Town Hall to witness this week's vote to determine the theater's fate.
That the theater offered something that was certainly unique and very identifiable and associated with the town of Highland. We looked at that we wanted to bring back what was there before, but then also look at adding some additional elements and really hopefully making this project to be a catalyst for further expansion and development of the arts district and the downtown at large.
Supporters hope a new and improved Town Theater Arts District will help revitalize downtown Highland. Area health officials are also mobilizing against a health scare. Lakeshore's Hillary Powell shows how.
Widespread worry about a national health threat has local infectious disease experts in high demand. The recent patient's death from Ebola at a Dallas hospital has made Ebola preparedness a top news subject, but Northwest Indiana health officials say they've been tracking and planning their response to the virus for nearly a year.
At Methodist Hospital in Maryville, new signs hang warning residents to watch for but not worry about the latest outbreak of Ebola virus.
So if somebody comes into our hospital, we have signs available, posted, where please notify one of our staff if you recently visited one of those countries or have had contact with somebody with this disease. And once that information is passed on to us, then we'll start to take steps, including isolation.
Methodist Director of Infection Control, Dr. Thomas Slujan, says regional health officials have been tracking the outbreak since its origins in West Africa in December 2013. Even before the first travel-associated U.S. case of Ebola was diagnosed last month in a person who traveled to Dallas from West Africa, Slujan says Methodist area hospitals, including the Gary campus, have put in place guidelines from the Centers for Disease Control and Prevention.
If a patient with Ebola were to ever show up on our doorsteps, we'll be prepared.
He says fighting myth with fact is a way to empower residents to protect themselves against Ebola, like knowing the way to contract the disease through direct contact, not through air, water, or food.
All kinds of bodily secretions, including blood, stool, urine, sweat. It is not necessary to wear a mask if you are traveling. The virus is not spread through that kind of casual contact.
And knowing that recognizing the symptoms can curb the spread of panic and pandemic.
The person is still not sick, not manifesting any headache, fever, abdominal pain, diarrhea, those symptoms that are associated with Ebola, then the person is not transmitting the disease to anybody. As long as that person is not showing symptoms, then he cannot pass it on to anybody else.
This week, officials at O'Hare Airport began screening passengers for fever on a thermal scanner when arriving from Guinea, Sierra Leone, and Liberia. Local officials are in contact with the CDC to get the latest training on the evolving threat.
Not only is it a moral responsibility of the United States, but it's the right thing to do because we too are at risk.
Officials reiterate that no cases have been suspected or reported in Indiana. On the medical front, antibiotics continue to save countless lives every day. However, unnecessary use of these medications can contribute to the development of antibiotic-resistant infections. A new study examined antibiotic prescribing practices in a cross-section of U.S. hospitals to see how common antibiotic use is, what type of antibiotics are being used, and why. Catherine Dolph explains in this week's JAMA Report.
Antibiotics are critically important drugs.
Very powerful antibiotics are being used in situations you wouldn't normally expect them to be used, which suggests there's probably room for improvement to eliminate unnecessary antibiotic use. Unnecessary antibiotic use is one of the key drivers for the development of antibiotic-resistant infections.
Dr. Shelley McGill and Scott Friedkin from the Centers for Disease Control and Prevention and co-authors conducted a cross-sectional survey of 183 U.S. hospitals. From May through September of 2011, each hospital selected a specific day to report on what type of antibiotics hospitalized patients were receiving.
1 out of every 2 patients that were surveyed was on an antibiotic. About half of all of the patients on antibiotics were getting 2 or more antibiotics.
This study appears in JAMA, Journal of the American Medical Association.
The very most common drug overall was a drug called vancomycin. When we looked at the most common antibiotics that patients were getting, we did find that they tended to be what we call broad-spectrum antibiotic drugs.
Broad-spectrum antibiotics, which are used to treat more resistant infections, were not only given to patients in the intensive care unit, but prescribed commonly in regular medical and surgical units, and also for infections that began outside the hospital in the community.
The line has really blurred between reserving these powerful antibiotics for patients that have healthcare-acquired infections and those that have community-based infections.
That might be an opportunity to look more carefully to see if there are ways in which use could be improved in those specific settings.
To help accomplish this, last March, the CDC asked every U.S. hospital to implement an antibiotic stewardship program.
Having a stewardship program that's got leadership, accountability, drug expertise, monitoring and tracking, that's a program that can make a difference for all of the providers that prescribe antibiotics in hospitals in the U.S. Antibiotics are a precious resource. They're life-saving drugs. However, we're at risk for losing their effectiveness and at risk for losing them for our generation and future generations if we don't act now to preserve their effectiveness.
Catherine Dolph, The JAMA Report.
Changes this month in Indiana law which allow all couples to marry have some local churches speaking out. Steve Walsh spoke to one area clergy member about how a ruling from the Supreme Court matters when it comes to faith.
Over the past couple of weeks, the same-sex marriage has become legal in Indiana. In the last week, a group of Catholic bishops has released a working document which suggests the church may soften its stance on gay parishioners and divorced Catholics who have remarried. Talk about some of the changes underway. We have Bishop Dale Melchick. Bishop, welcome to the show.
Hello, thank you. Good to be here.
So it seems to be a debate over whether the church is looking at changing its stance on some key social issues. Are we seeing a change here, or are we just seeing kind of a softening of the language coming out of Rome?
Well, I think we're seeing the effects. You talk about the Pope Francis effect, and we're talking about the effects that the Pope has had in the months that he has been, maybe almost a year and a half since he's been Pope. And he's really looking for a change in tone, a change in attitude. He challenges all of us who are church, that's all of the baptized, to share God's love with others, and he challenges us to go to the peripheries. And so everything we do, I think, is to have a different tone, a tone of welcome, a tone of acceptance, and I think that's a lot of what we're seeing here.
But is this a real fundamental change for the church? Over the last couple of days, we've heard a lot of people saying that this synod that's happening in Rome, that this really represents a shift in Catholic doctrine. Does it? Is this, if you're somebody who is gay, are you going to see a very different Catholic church in the next year?
You're going to see a church like we're supposed to have been all along, and that is a more welcoming, compassionate, understanding church. Our understanding of marriage can't change because we believe that God instituted marriage as a permanent covenant between a man and a woman, ordered to the good of the married couple and to the procreation and education of children. So that isn't going to change. But we've always said, whether gay or straight, we are all children of God. We're all created in the image of and likeness of God, and we need to respect and love one another.
In Indiana, it's more than just a welcoming stance. They've legalized same-sex marriage in the state of Indiana. What has been your reaction so far?
Well, we would maintain that whatever the civic society says can affect our doctrine. And so you won't be seeing the Catholic Church witnessing the marriage of gay couples, because as I just mentioned, our stance on what marriage is, not dependent upon the state, it's not dependent upon the church institution or any others. We firmly believe that this is instituted by God, and we must respect that.
If you're that same-sex couple, you're two men, you're married legally in the state of Indiana, and you arrive at a parish in Gary, what's going to be the reaction?
Well, I would hope it would be very welcoming. You know, we welcome everyone to church and into the parish, and we hope that they would feel welcome and not discriminated against in any way.
There are many things. I mean, church is all about family. Many things done with couples and with children. Will they be represented fully in the Catholic Church now that this is legal in Indiana?
Well, the fact that it has become legal in Indiana isn't going to have any bearing on the church. We welcome them as children of God. We welcome them as our brothers and sisters, and we would love for their participation in the parish and their involvement in the parish.
Well, that's where we're going to leave it. Bishop Dale Melzick, thank you so much for being on.
Thank you very much, Steve.
A new exhibit this month at Indiana University Northwest means to bring a closeted issue out in the open. The Clothesline Project is an exhibit created by a group of women to spark conversation about sexual assault and domestic violence. The project uses October, Domestic Violence Awareness Month, as the backdrop for the display. Organizers say the laundry theme helps people see abuse is an everyday event that needs more awareness. Lakeshore Report visited the exhibit, which runs through the 24th. Here's a preview.
This is an opportunity to show that dirty laundry and to break the silence about violence against women. Yellow and tan signify battering, abusive relationship. Red and pink stand for rape and sexual assault. Green and blue stand for childhood molestation. White stands for someone who was murdered as a result of violence. Black stands for somebody who was violated as a result of his or her political views. Purple stands for those who have been violated because they are gay, lesbian, or transgender.
To me, the Clothesline Project is basically giving a voice to people that didn't really have one beforehand. People are really closeted or quiet or secret about what happens to them. And this is just giving them a free way to express how they feel and tell people their story.
It really is very opening for everyone. Embracing that on a t-shirt, expressing what they've been hiding for so long.
So it's more of a statement of survivors, and it's a healing opportunity for them.
There's a more lighthearted art collection on display in Northwest Indiana. John Kane has more in this week's Eye on the Arts.
Joining me for this edition of Eye on the Arts is Amy Davis-Neverdauskas, Marketing Director for the Lebesnick Center for the Arts in Michigan City. And Amy, nice to have you back.
Thanks for having me.
So you always have great exhibits up, several at a time.
Yeah.
Yeah. So what's up right now?
We are about ready to open the Comics and Code exhibit, and along with that, in our upstairs galleries, is going to be It's Not Your Sunday Comic Strip.
So they're related.
Yes.
And so obviously comics is the theme.
Yes.
And who's in the show?
In the show, there are several different artists. Shall I list them off, or just a couple of the highlights?
Highlight for us.
There's a couple people that are more local. There's an artist from LaPorte, and his name is Paul Schultz. And then there's another artist, Corey Hampshire, who actually is an artist for both Marvel and for the Walking Dead comic series.
So these are people who have currently or have had careers in comic art.
Yeah, it's a nice range of artists that are emerging in their careers, as well as people that are pretty well established. So it's a nice range of career level, as well as genres within.
So does it reach back in time several decades as well as contemporary themes, or is it mostly all contemporary?
I believe it's mostly contemporary. I think that they're probably in the It's Not Your Sunday Comic Strip. There's probably some things that go back farther in that exhibit.
And so how many artists are in the show?
I would say it's less than a dozen.
Okay.
Yeah.
And this, the opening is going to be in conjunction with your First Friday.
Yeah, so the exhibit opens, but the opening reception is November 7th during our First Friday at 5.
And that's when there's lots of activity going on along Franklin Street in Michigan City.
It's a whole event that goes on downtown from 5 to 8 on November 7th. So we try to do our receptions.
So lots of artists, and then there are lots of artists in that Prince Street. What is that called? The Prince Street Gallery?
There's Prince Street Gallery. There's several different galleries along Franklin Street that have opened up. So
and then the Prince Street Gallery has artist spaces like workspace.
There's the South Shore, there's the Southern Shore Art Association, but then there's the Art Space, which is going to be close to Prince Galleries.
Okay.
But
so
that's
a
not
lot
open
going
yet.
on.
Yes,
okay,
absolutely.
well, thank you for being here to tell us about it.
Thank you.
And thank you for watching. We'll be back again next week with another edition of Eye on the Arts.
Eye on the Arts is made possible in part by South Shore Arts, the Indiana Arts Commission, and the National Endowment for the Arts, a federal agency.
Each month, Lakeshore Report teams up with the Society of Innovators of Northwest Indiana to highlight some of the best forward-thinking projects and people the region has to offer. This week, we visited Dunes Creek in Chesterton to see how a new project is helping a natural resource go with the flow.
Daylighting basically refers to the restoration or recreation of a stream or stream channel where a parking lot has been put in its place. We basically removed the parking lot and recreated the original stream channel. This creek, Dunes Creek, is actually the creek that drains an entire 7,400-acre watershed. And this watershed is almost entirely natural until you got to the last 1,500 feet. In the last 1,500 feet, the stream was channelized into a culvert, and this culvert ran under 2 separate parking lots. So the last 1,500 feet of this natural watershed ran underneath the parking lot in a culvert. Once we removed the first section in September of 2008, there was a very large ongoing rain event. We received over 16 inches of rain over a 4-day time period, and our main parking lot collapsed. And instead of just fixing the lot as it was, to continue the daylighting of Dunes Creek. So now the entire watershed is natural all the way to Lake Michigan. Not only did it improve the park's resource itself by recreating the stream, improving the ecosystem, it also made great aesthetic improvements to the park. You now see the beautiful area that we have now. It's the first of its kind in the state and one of the first of its kind in the nation. The success of this project did reach a wide audience that was broader than simply in Indiana. So I think that the success of this project has been a springboard for several others throughout the nation.
For more information about the Society of Innovators, a project of Ivy Tech Northwest, go to www.nwisoi.org.
That's right, and you can also always send us your questions, comments, and concerns to tvfeedback@lakeshorepublicmedia.org. We're also on Twitter and Facebook at Lakeshore Report.
And if you'd like to find out anything more about our stories, go to our website, lakeshorepublicmedia.org. Thanks so much for joining us. We'll see you next week on Lakeshore Report.